Hi guys, Heather here. So I've had a few questions about labor and delivery. Hi guys, Heather here. I've had a few people ask me, what exactly is labor and delivery like? Well, thinking back to my nursing school clinicals, I remember the guys being like super excited about this rotation. I mean, really, what guy wouldn't be excited about hanging out with pregnant ladies all day? Can you name one? I can't. In fact, when I would come home and talk to my parents about how my day went, my dad was even jealous of me. Okay, maybe I took that one a little too far. So the nurse I was following around that day had two patients, and the first lady came in, we started her IV, hooked her to some IV fluids, she had an epidural, maybe had some Pitocin hanging to induce labor and a fetal heart tone monitor, and she went to sleep. And first of all, I was wondering, how is she so calm and not screaming? That epidural must be some good stuff. So the nurse monitors the contractions and the fetal heart tones in the nurse's station on a monitor and goes in so often to check how many centimeters dilated she is and how far the baby's head up is, or if he's starting to peek out. So this lady continues to sleep. I didn't hear a peep out of her. Her husband's sitting in the chair next to her. And finally, the nurse has to wake her up to straight catheter because with an epidural, you most likely don't have a sensation to urinate. That is a perfect time to be cath, right? When you can't feel it. So then after some hours went by, the nurse does her exam and wakes the patient up to start pushing. The freaky thing is the doctor's not paged until the baby's like ready to pop out. I sure wouldn't want to deliver a baby by myself. I would probably faint right there, and then the baby would have to deliver himself. So this delivery went very smoothly, and I thought to myself, you know, giving birth isn't so bad. Maybe I could even do it someday. On the flip side, lady number 2 comes in. It's like her third child. She's begging for an epidural, but she has to be put on the waiting list because the anesthesiologist has other moms to attend to. She's screaming with every contraction and asking where the heck her epidural is. So the nurse does her exam, and it seems she's dilating pretty quickly. Contractions are very close together. So it probably wouldn't be safe to do an epidural because you have to be still for that, and there just isn't enough time. I just can't imagine having a needle stuck in my spine, but compared to the pain of not having one, please, by all means, stick me in the back. So she continues to scream bloody murder, and everybody can hear her down the hall. It kind of sounds like a horror movie. And as you can imagine, she's probably cussing at her husband for putting her in this situation like they do in the movies and squeezing his hand into something like orange juice. The next minute I know, the baby pops out and says, "Hi, Mom," or something like that, and then carried off to the baby warmer and cleaned up, tested for reflex, APGAR scores, all that good stuff. So there you have it, labor and delivery at its finest moments. It's a different kind of nursing than what I'm used to, but it could be adventurous and exciting in its own way. Well, thanks for watching, everyone. I'll talk to you soon, okay? Bye!